So, we're taking a closer look at some of the major medical news and developments when it comes to the coronavirus. Emergency medicine physician Dr. Uche Blackstock is with us from New York City to give us some insight. You are a Yahoo News medical contributor and the founder of Advancing Health Equity. Thank you so much for joining us. And so, we are going to start with schools. School districts around the country are now grappling with how to reopen safely, and parents really have to face a tough decision. Where I live, the public school system started this week. They're virtual, I think, for the beginning, and then they're going to reassess that. The school that my daughter goes to basically gave parents the option. You can choose virtual, in-person, or hybrid. And I didn't realize how overwhelming that decision would be. And part of it has to do with, we don't have a lot of we have a lot of information, I should say, about the coronavirus, but things are constantly shifting and changing. And then you also sort of have to factor in, the racial and socioeconomic disparities in this country. Do people have access to the devices that would allow for, good virtual learning? Within virtual learning, are children going to be treated equally? There are all these questions that I never thought I would have to answer as a parent. So you are a parent and a doctor. Can you talk about, some of the things that maybe parents should be considering, what you've been experiencing in making this choice?
Yeah, no, thank you for having me back. I agree. These are incredibly personal and complicated decisions. And as you alluded to, we almost have an overwhelming amount of information, but then we also have a lot of unanswered questions about coronavirus since it's a novel virus. And so I will say what I've been doing in my experience is thinking about what is the community transmission rate. We know that's one key factor, the infection rate in the community. The CDC and the WHO are both saying if the infection rate is above 5%, you cannot open schools. Now, if the rate is below 5%, we need to make sure that schools have the appropriate resources to open. So that's PPE, the space to be able to separate students into smaller cohorts. And we also need to make sure there's a testing infrastructure in place, as well as the usual preventive measures that we've been talking about with coronavirus. And so, I think it's going to be a lot of the decisions are going to be up to, the families, but also depending on the schools, the locations, the leadership at the schools, how the teachers and educators feel as well.
Let me ask you about this vaccine. So we hear from the CDC that they're preparing, or they're telling states to prepare to distribute a vaccine as soon as November 1st. And the CDC basically said, oh, this is like normal procedure. But I think it caught a lot of people off guard because we had already heard that a fast-tracked vaccine would be available maybe in January. And now we're hearing maybe in November. So I just want to get your take on this because, the process of bringing a vaccine to market, the trials, have traditionally left out minority communities. There are often fewer members of minority communities of color that participate in these trials. So already there's like a bit of a disadvantage in terms of its effectiveness and how it affects certain communities. So when you hear get ready by November, what do you think?
Well, I have to say that news was incredibly disconcerting because what we do know about vaccine trials is they take typically at least 10 years. So we really are fast tracking this entire process. And I have to say that the phase 3 clinical trials in particular are really the most important part of the trials. Those are the part of the trials that assess for safety and effectiveness of the vaccine. So we really need to get that right. And so what we're seeing, with this this early date for distribution of vaccines is this politicization of this whole public health crisis, right? We're seeing that it's happening at and around the time of Election Day. And I worry that this is going to produce more vaccine mistrust and distrust, especially in Black and Latinx and Indigenous communities. And as you alluded to, that distrust is already there. And so people have concerns about whether a vaccine is safe to take, whether it's effective. They're not going to be willing to take it as early as November. And I have to admit, even myself as a healthcare worker, I would be in that first group eligible to receive that vaccine. And if that vaccine has not gone through phase 3 clinical trials, I would be very wary of myself taking the vaccine for coronavirus.
Yeah, in the last few weeks, I've seen a number of polls taking a look at who would be most open to taking a vaccine. And I mean, I just sort of Googled to see quickly if I could pull up any of those polls. And the first one that came up was one by blackdoctors.org. And they found that 58% of their Black respondents said they would not take a vaccine. And so now we have, a top health group advising U.S. officials to release a federal plan. How are you going to go about distributing a vaccine when one becomes available? And I'm wondering, should this plan include a focus on minority communities, Black people, the Hispanic community, American Indians, people who are disproportionately impacted by COVID-19? Because I think it's not only going to have to be, making sure that the vaccine is available, that they have physical access to it, but I think there's going to have to be a whole education and marketing component to it to convince people that it's safe.
Right. And so, it first starts with ensuring that we have a diverse representation in the clinical trials themselves. And I know that some companies like Moderna are really trying to engage in outreach and education in Black, Latinx, and Indigenous communities. But then I think once we do have a vaccine available, things to consider are, like you alluded to, the vaccine distribution strategy. And one of the recommendations that came out of recently from an NIH panel was to consider giving it to not just healthcare workers first, but people with underlying medical problems or people who have jobs that put them at risk for infection. So using those criteria as sort of a proxy for race and racism. And so we'll see how that works. But definitely there's going to have to be considerable engagement with community-based organizations and with trusted leaders when a vaccine is eventually developed, to ensure that one that is safe and effective is one that community members will agree to take and feel confident taking.
Mm-hmm. I want to ask you about another way this pandemic has impacted people that we don't often talk about. Researchers say that the rates of depression are triple pre-COVID levels. I think when they took a look at it right at the beginning of the pandemic, it was triple, and now we've had sort of months of this, piling on also the social unrest and all the other issues, the coming election, you name it. There's a lot going on, the economic uncertainty. But I also think about communities of color. And even before this pandemic, even before everything that 2020 has brought, there had been a conversation about communities of color feeling comfortable accessing mental health experts, professionals, and whether or not there were enough mental health experts of color available. Can we talk about just the mental health impact of what we've been dealing with during 2020, particularly the effect on communities of color?
Yeah, it's such a great question. There was even a study recently, a few weeks ago, by the CDC that showed that Black and Latino Americans, as well as essential workers, had high rates of depression and anxiety related to the coronavirus pandemic, and had also increased thoughts about suicide. And so what we do know is that those communities have suffered not just from infections and death rates due to coronavirus, but also job loss. So they have sustained significant economic and financial loss. And so, those factors definitely would influence, the mental health of somebody. And so combine that with the fact that pre-pandemic, there was already a dearth of Black mental health care professionals, psychiatrists, and psychologists. Added onto that, this mistrust of accessing mental health professionals. And so I think in this moment, what we need to see is really an effort to engage Black and Latinx communities around addressing these mental health problems, and to allow them to be able to access them in easier ways, like whether it's through telehealth, through social media, through group chats. I think these mental health societies are going to have to think about how do we do outreach and education so that we can really mitigate the effects of coronavirus on these communities in terms of mental health.
Yeah. Definitely. Dr. Uche Blackstock, always a pleasure talking to you. Thank you so much.
Thank you for having me.
So, listen, if you or someone you know is struggling with suicidal thoughts or emotional distress, you really should call the number on your screen. It's 1 800 273 TALK. That is the number for the National Suicide Prevention Lifeline. It's free, it's available 24 hours a day, 7 days a week.